So how do you answer question? How do you approach NCLEX question? I don't know your strategy because sometimes you may don't know everything, but the board, you got to figure out how to go through these questions. You may know. So first of all, you got to know your content. Then when you see a question, don't rush, don't panic. Just pay attention to what I call buzzwords. They are buzzwords. It should be ringing in your ear. When patient come to the emergency room and complaining about symptoms, there's one thing the doctor is focusing on, and that's what you too you should be doing. This is a straightforward question, but it may be difficult, right? When you see your question, just read it from the back. Which prescription the nurse should anticipate? Just by that, I know at the back of my mind is telling me, hey, prescription. So it can be medication or intervention. Sometimes they use the word interchangeably. They will use the word interchangeably. So just be careful. And then you look at it and said, okay, I'm looking for prescription, right? And next, administer midazolam. That's the buzzword right there. Bolus to a client before a procedure, right? The client blood pressure is now 86/40, and the heart rate is that. Which prescription the nurse should anticipate? Think about it. You have all the information to be able to answer it. There's a key information there. I need a prescription, right? That's the what is being asked. What is the case? I give a patient midazolam for a procedure. Now, your blood pressure is 86/70, heart rate of 110. What is your buzzwords? Your buzzwords are this: heart rate 130, and then blood pressure 86/40. What does that tell you? If I tell you a patient blood pressure is systolic in the 80s and blood pressure in the heart rate in the 130, what does that represent? This patient is in shock. Is in shock. Is he bleeding because in shock? No. Why is she in shock? She's showing, he or she is telling you that they are in shock. What is the problem? Think about it. What do we give the patient? Midazolam, IV. Is the medication now making them hypotensive and tachycardia? Why are they tachycardic? It's because I give them a benzodiazepine and it dropped their blood pressure. It's a downer. It dropped the blood pressure. When your blood pressure drop, your heart rate will respond by going up in order to increase your cardiac output. This is shock 101 because your cardiac output is based on what? Stroke volume times heart rate. So if you're a nursing student listening, this is the basis of pathophysiology, right? Your heart rate goes up when your blood pressure goes down. It's because I want to maintain my cardiac output. So test taking strategy. What is the board question? This question is asking you. It's just an antidote. I give you midazolam, well, and you do not respond it well by telling me your blood pressure is going down and your heart rate is going up, what medication will you give them? Think about it. What do you think this patient should get? What are you going to give them? You know, naloxone is an opiate. I never give you opiate. Naloxone is for opiate. I never give you opiate. I give you benzos. Morphine is an opiate. This is what you use this for. Atropine. Think about it. If I give you atropine, it's for what? Bradycardia. That means your heart rate will go up. His heart rate is 130. Don't do that. Don't do that. These are all traps. Patient heart rate is 130. You can't give them atropine. The patient is not bradycardic, it's tachycardic. You should not choose number 4. You get flumazenil. That's the antidote for what? Midazolam. This is pharmacology, right? A nurse is aware of 4 clients at change of shift. Which client situation need a follow-up? Prioritization 101. You know what is an expected finding and know what. And when you are being sharp, you're taking care of the breathing problem, shock, sepsis, airway, neurological problem, and pain. Pain that is going to kill you, lose your life and your limb. Straightforward, right? So, what do we have? You don't going to get trapped. Don't let the number deceive you. I have emphysema. Divide the thing into three. Two, you have emphysema. They tell you the PaO2 is 88. If patient has emphysema, do I expect their PaO2 to be 88? If you are not surprised by it, then let it go. If you're surprised, that's your answer. You have hyperthyroidism. Your heart rate is 110. Is it expected finding? Amyloidosis, ALS, right? And the inability to cough. He can't cough. Do you expect that to happen to that patient? And if you see that, should you be worried or not? I have pneumonia. My temperature is 101. Question. If I have emphysema, PaO2 88 is normal. This is not saturation. It's partial pressure of oxygen. So that is normal. Right? Hyperthyroidism, they're usually tachycardic. Heart rate of 110 is an expected finding. That's one of the common things they complain about, palpitation. ALS is a neurological problem. Number one priority is airway. What is the airway? Swallowing, speech, dysarthria, inability to cough. That's the airway problem. Pneumonia, you have infection. I'm not worried about your temperature. It's fine. The only thing I'm worried about you, pneumonia, is when you have airway problem, right? You're having desaturation. So this patient gets this. Okay. So I just break it down to you and say normal, A is normal, B is elevated, heart rate is expected finding, pneumonia, who have fever. It's no problem. Just don't be surprised. This is a hard one. It's a test-taking strategy. As we go through, I'm going to put a hard one to let you think, right? I'm going to put hard ones there to let you think. So, a nurse provide care for a client receiving 1% lidocaine during a skin biopsy in a clinic, right? One. I started to read it from the beginning so that you can see what I'm trying to say. Client immediately became confused, drowsy, and reporting periorbital numbness and metallic taste. Which prescription the nurse should anticipate? Reading from the back. Which prescription should the nurse anticipate? That is what you are being asked to do. Pick a prescription here. What is the case? Patient was getting 1% lidocaine. It's a local anesthesia to do a biopsy. All of a sudden, you are confused, you're drowsy, reporting periorbital numbness and metallic taste. A bunch of words. Don't freak out. Don't worry about it. You did something to the patient. Whenever you're answering the question and there's an intervention, make sure that whatever you're doing did not cause the problem. And if it's causing the problem, then go and fix it. We injected lidocaine, and all of a sudden, I'm confused. I'm drowsy. I have numbness on my lips, and I have metallic taste. What do you think is going on with this patient? Test-taking strategy. What do you think is wrong with this patient? That's why she's behaving like that. Toxicity is a systemic manifestation of lidocaine. And that is what is causing the problem. And now the content is that you got to use that lidocaine, local anesthesia, causes toxicity. There's two things they cause. So, cardiac problem and then central nervous system problem. Two things. Those are the things. But remember, I injected some lidocaine and it's making you sick. This is the same thing as the first question. We injected midazolam and the patient was sick. We use an antidote. If I injected lidocaine on you, well, then you should use antidote. Antidote to take care of it. They're going to be hypotension. They will have hypotension. So you may give them fluid, right? They're going to have hypotension. So metoprolol is not that great because of cardiac dysfunction. Phenytoin, and this is the problem, is because they will get seizures. So lidocaine toxicity will give you seizures. So you need to give them benzos to help with the lidocaine toxicity, but there's no benzo here. There is what? Phenotime, which is used for seizures, but it's a long acting. It doesn't take effect in acutely. So this is gone. You're using the content. The propofol can pull lidocaine out of the body because it's fat. It's fat soluble, so you can absorb all the. So you inject some propofol lipid emulsion, and that pull everything. This is a hard one, but this is you don't. I'm not saying if you can't even know the answer, it's fine. But I just it's the thought process. I want you to go through the thought process and say, oh, okay, I can eliminate this. If you know the content, you know that you're going to give them fluid, but that's not going to help if there's the bad medication is still floating in their system. So you should give them emulsion of lipid emulsion, and that is propofol, and that will help with that. So this is this third question, okay? Rationale, that's what people do. Okay, a novice nurse provide care for a client with acute respiratory distress syndrome receiving full ventilatory support. 7 a.m. ABG shows pH of 7.29, PCO2 of 32, bicarb of 90, and PaO2 of 90. The novice nurse will anticipate which prescription from their healthcare provider. It's not enough to know that what this is acid-base status is. This is what the question is. Just you can define what it is, but I'm not asking you to do that because I want you to think. Your board will want to let you think and say, how this is clinical application of that. So how much ABG you know? Well, I don't know. But if you need some help, you should check out that thing, right? And I've told you guys, yeah, I made a free video over the ABG, how to calculate it, right? I use the pH 7.4. So if you less than 7.4, you are an acid. That's all. If you're greater than 7.4, you are a base. I use bicarb 40 for CO2, and I use the bicarb 24, right? I look at it. We have an acid problem. Therefore, I got to see who is causing the acid. If CO2 is causing the acid, it will be more than 40. It will go to like 60 or 50 or something. Therefore, I know CO2 is not the problem. It's the bicarb. If the bicarb is causing the acid, then we have a metabolic problem. That's all. Metabolic acidosis. So that's what we have. Metabolic acidosis. So we have metabolic acidosis problem. Then you ask yourself, well, I have to check for compensation. To compensate, your metabolic become respiratory. Your acidosis will become alkalosis. So I need respiratory alkalosis. I'm looking at my CO2. Respiratory alkalosis should be lower than 35, right, or 40. It's lower, right? But my pH is not enough. It's not normal. Therefore, this is not completely compensated. It's uncompensated problem. I need to drop my pH, my CO2 really low, more. That's all. Therefore, in order the pH to be normal, the CO2 need to come down more. So what would the nurse do? What would the nurse do? This is test-taking strategy, critical thinking. Fraction inspired oxygen. This is FiO2. Usually 100% is the maximum. We breathe in 21% FiO2. You listen to me right now, you breathe in 25%, 21%. We use it to increase your oxygenation. This patient does not have oxygenation. His SAT PO2 of 90 is great. His SAT probably will be like 93 or 95. So this one is fine. Therefore, I don't need to give them more oxygen. Keep the head of the bed at 30 degrees. Fine. But we don't have head injury problem, right? We don't have head injury problem. It's going to help with oxygenation, right? So this is not in case. If I increase their respiratory rate, I'm going to blow more CO2. So CO2 will go down. If I decrease the tidal volume, I'll retain more CO2. Hypoventilation, you retain more CO2 and you become more acidic. And therefore, 4 is wrong. And therefore, the nurse should be increasing respiratory rate. Thus, if you answer this question and you know this, I know you know AVG, right? And nurse provide care for a female client in the family medicine clinic with urinary retention, urinary tract infection. The client is prescribed what? Doxycycline at discharge. Which action by the nurse is a priority? These are one of the things when you're taking the test, you have to pay attention. Why did I give you a female client? I don't give you age, but I give you a female because I want you to focus on something. This is the buzzword. Then priority. That's what I want you to focus on. UTI doesn't matter. I give you doxycycline. So 3 things you have to connect the dot. Connect this dot. Female client, doxycycline, priority. What do you think I'm trying to tell you? Actually, why would I want you to ask you? I just told you it's a female. I never give you an age. That means it's a buzzword. You should not let that go. What would be your answer for this? Do you check their vital? You check their CBC? You check their beta ACG? Or you recommend prescription for oral contraception? Who know this answer? Who know it? Tell me if you know it. Make clients, you have to be careful. It can be dangerous. If you take it and you get pregnant, it's a problem. If you take it and you get pregnant, it's a problem. Therefore, I told you that's the buzzword. Checking their vitals is irrelevant, right? Checking their CBC is irrelevant. It has a UTI. We're going to give you some antibiotic, right? Now, these are the 2 critical thinking questions. A lot of people will pick this. A lot of people will pick this. Which one do you think is as a priority? That's why I told you connect the dot. Which one is the priority, right? You have to think that this tetracycline oral contraception does not work. Because of that, we teach them to wear condom or barrier method. So that's the way why I make this question like that. To think, let you think, tetracycline, you should not be taking oral contraception. You should be using barrier method. So therefore, this is wrong. You left with C. You got to choose C. And then provide care for a client who developed what? Systemic toxic reaction following a regional block. Which of the following priority action the nurse should take? Who can figure out what this is about? Who can tell me what this question is all about? You will see these kind of questions in your NCLEX. I intentionally did it. What am I trying to say? Who can tell me what is this question about? What did I do? I did exactly what some people tell me they see in the boards. I did exactly what some people say they see in it. Do you recognize this question? Number 6, does anybody recognize it? What can you tell me about it? This is the same thing question we saw on the lidocaine. If you look at it, I said regional block is a lidocaine, local anesthesia. And I said the patient has developed systemic toxic reaction. It's the same thing as local anesthesia toxicity. Therefore, what would you do? Keep the patient in a supine position, check their urine output, give them diazepam, or stop the IV fluid. I told you the number 1 is their airway because of their central nervous system and then the cardiovascular system. And so for central nervous system, you want to prevent seizures. So if you want to prevent seizures, what medication you want to use? IV fluid will not do that. Urine output will not do that. Keep them in a supine position will not do that. It's that one. So this is the same question, but in a different format. So pay attention to that kind of strategy as your board will do that to you. Okay. And the nurse should expect or not expect, right? Buzzword is all going to win the day, right? CVP, central venous pressure of 20 millimeter per mercury. What does that mean? Who knows what it means? If I tell you patient CVP is 20, what does that mean? Venous pressure or a low central venous pressure? Is it high or low? This is a high central venous pressure. Oh, that's all the question is asking me. Fluid overloaded. Now look at this and see if this is consistent with fluid overloaded. Long crackles, well, I should expect you to have a long crackles if you are fluid overloaded. Skin tenting, no, I don't expect your skin to be tented like that. Thready pores, no, your pores should be bouncing like hell, so it's not expected. Your skin is cold, no, it should be warm. Hypotension, guess what? You know the answer. What do you think? What do you think the blood pressure is going to look like when you're fluid overloaded? Expected, right? Capillary refill greater than 3 seconds. What do you think? That means there's less blood flow. It's not expected. Periorbital edema. Your face is going to swell. So this is an expected fact. What did I do? I take the content, fundamental, fluid management, and I just create some crappy question just to test your brain and your knowledge. That's all. That's the question. This is the same thing. And then provide care for a client with the serum creatinine 2.3. Which prescription in the other sheet the nurse should question? That's all. You see this kind of question, don't guess them, break them down. It's a select or apply. Pick those that you're confident. What is the buzzword? A creatinine of 2.3. What does that mean? It's abnormal. It's too elevated. If that is the problem, your kidney is in trouble. Therefore, don't pick an answer that is going to make your kidney in trouble. You look at the answer choice. Is any of this going to make my kidney in trouble? Then don't pick it. And they said, you should question. That's your answer. So if I'm going to question that, I will see something that will put my kidney in trouble. Which of these will put your kidney into trouble? Tell me. Which of these will put your kidney into trouble? Indomethacin is an NSAID. Your kidney is in trouble. Ketorolac is an NSAID. Your kidney is in trouble. Acetaminophen affects your liver. Aminoglycoside, they aid your kidney. They don't like it. And vancomycin is number one, notorious. Does not like your kidney. So those are the ones you got to check, right? Return phone call the nurse should make first. Go back to the question. Don't answer the question because then you don't know what is being asked. I got to call somebody first. What is the problem? Their kids have flu. That's all. And they are children, school age. Which one is bad? Receiving acetaminophen for a fever of 101.1, Motrin for a body aches, Salicylate for body aches, ibuprofen for fever of this. Don't tell me this question is hard. It's just to awareness, thinking, and be able to recognize it and say, oh, I know this. Therefore, what is this? What is your answer? Who is in trouble? There's a keyword in the question, and the keyword is flu. The keyword is flu. Does flu relate to this? Do you see anything that is contraindicated in flu patient? Well, Tylenol, acetaminophen is okay for fever. Yeah, I can use it for flu. Motrin is okay for body aches. You get, and it can treat the body ache. You should not give a kid with a viral illness any salicylate. Salicylate is a form of salicylate. They can give you Pepto-Bismol. It's the same thing. Any salicylate derivative should not be given to the patient because they get Rey syndrome. That is the basis concept for this question. So this one is your right answer. Okay, guys, once again, this is Adapting Class. Thank you for joining in. If you have any question, email me. We have a course coming in January. If you want to learn some content, if you want to use a YouTube, yeah, you can join our membership. All these free videos. And novice nurse provide teaching for prescribed medication and teaching for several clients. Which client teaching is appropriate or not? They prescribe medication, right? And they're going on, and you want to provide teaching for them. Lithium, increase your sodium-rich diet intake. Warfarin. I said this because these are the traffic questions. I put them in one table for you so that you never forget. Warfarin, increase your vitamin K rich diet intake. Digoxin, increase your potassium rich diet intake. Tizaparin, avoid vitamin K rich diet intake. Phenytoin, ensure high protein diet intake. Atorvastatin, take the medication in the morning. A bunch of concepts, right? I put it there for you. Who can answer all of them? That means you master your pharmacology. Lithium, the key is consistent amount of sodium. I don't have to go into detail. I can explain to you why if you increase your sodium too much, it affects your lithium level goes down, and you have patient will you go into maniac. If you decrease your sodium too much, you have lithium toxicity. Therefore, this one is not appropriate. Warfarin, consistent amount of vitamin K dependent diet. You should not go up, you should not go down, you should be stable. Therefore, this is not appropriate. Digoxin, you should avoid low hypokalemia, but that does not mean you should increase your potassium. Once again, avoid hypokalemia. It does not mean you should increase your potassium. Just make them normal. So not appropriate. This is traps. I put it in one question. Like I said, every Wednesday I'll be here 5:30 to help out with test taking strategy. But these are questions I'll create on my own just to like highlight some key points. I don't know if you come in your test, but if you know it, if you see them, you run away from it. Tizaparin. This is the same as enoxaparin, right? Avoid vitamin K rich diet. There's no diet modification with these problems, therefore it's not appropriate. Phenytoin. What you should know in your board, they hate protein. You should not be taking protein, high protein diet when you're phenytoin. Or your patient is on 2 feet, you stop it. 2 hours. Not appropriate. Atorvastatin. You take it in the evening because steroid, cholesterol are made in the evening. Therefore, not appropriate. All of them not appropriate. Why I put them there? It's a trap. They are trap questions. Okay. And this is the end of it, guys.